Hello, my name is Peyton Watley. I am a junior health science major from Rancho Cucamonga, California, attending Spelman College, and I will be presenting an independent research article video presentation. As an introduction, we have been introduced in 2020 to the pandemic of coronavirus, and studies including this one show that wearing surgical masks help to reduce the upward trend of influenza virus RNA and coronavirus RNA in aerosols and respiratory droplets. To begin the study that led to the conclusion that surgical masks prevent the transmission of human coronaviruses and influenza viruses from symptomatic individuals, researchers asked two questions. What is the quantity of virus that is transmitted through exhaled breath of patients with ARI? And will surgical face masks prevent the transmission of respiratory viruses? In regards to the population demographics, researchers screened 3,363 individuals in two different study phases, and 246 of those individuals provided exhaled breath samples. 122 of the 246 participants were randomized to not wear masks when exhaling, and 124 out of the 246 were randomized to wear a mask. 49 provided and a second exhaled breath collection. In regard to the recruitment process, participants were recruited year-round from March 2013 to May 2016 at a general outpatient clinic of a private hospital in Hong Kong. The individuals were screened by clinical staff in order to determine if they met the criteria for the study and to collect data about their symptoms. The participants were asked to perform tasks such as breathing and exhaling without a mask, and they voluntarily performed and received compensation for each breath collection. The participants received a supermarket coupon worth about 30 US dollars and a tympanic thermometer worth about 20 US dollars. The participants also signed a written consent form for those that were over the age of 18 and a written consent form from the legal guardians or parents and self of those that were 11 to 17 years old. As we can see in the reporting summary, um, in figure one, it depicts the efficacy of surgical face masks in reducing respiratory virus shedding in respiratory droplets and aerosols of symptomatic individuals with coronavirus, influenza virus, or rhinovirus infection. The sample was collected from a nasal swab, respiratory droplets, and a throat swab to show the virus copies per sample for coronavirus. For the respiratory droplet samples that were collected, 30 were with and without a mask. The same was depicted in figure 1B and 1C, but for the influenza virus and for rhinovirus. For each of the copies per sample in each virus, there was a higher and more broad number of samples collected from the throat and nose swab. This can be related to the current testing that is being performed worldwide, which is typically nasal swabs. There is also the least amount of droplets for those that were wearing a mask, which adds to the scientific question of the efficacy of masks. In Table 1A, it depicts the characteristics of individuals with symptomatic coronavirus, influenza virus, and rhinovirus. In the table, it states the female age group, chronic medical conditions, influenza vaccination, whether they were a smoke or not, time since the onset of symptoms, history of measured fever that was more than or equal to 37.8 degrees Celsius at presentation, the measured body temperature at enrollment, symptoms at presentation, and the number of coughs exhaled during the breath collection. In addition, the characteristics of the participants were compared to those with coronavirus, influenza virus, and rhinovirus to the total number of those who provided exhaled breath. The significance of this table is that those with the influenza virus were twice as likely to have a high fever, and those with coronavirus coughed the most during the exhale collection. Participants were asked to answer a questionnaire, and data was collected by clinical staff in order to provide Table 1A. In Table 1B, it depicts the efficacy of surgical face masks in reducing respiratory virus frequency of detection and viral shedding in respiratory droplets and aerosols of symptomatic individuals with coronavirus, influenza virus, and rhinovirus infections. The table compares the droplet particles and aerosol particles of those with and without masks. It depicts the viral loads and the detection of the virus as it presents those without face masks presented with the virus at a higher rate and a significant reduction in those that wore masks. Um, in order to conduct and create the figure, the data was collected through respiratory droplets and exhalation. In addition, extended data that was provided, there was 8 different tables that depict something different for each graph. The first was the weekly number of respiratory infections identified by the RT-PCR in symptomatic individuals who had provided exhaled breath samples during the study period, as well as respiratory virus shedding in the nasal swab, throat swab, respiratory droplets, and aerosols in symptomatic individuals with coronavirus, NL63, OC43, HKU1, and influenza A and B virus infections. In addition, the efficacy of surgical face masks in reducing respiratory virus shedding in respiratory droplets of and aerosols of symptomatic individuals with seasonal coronavirus, as well as seasonal influenza viruses, was depicted in some of the graphs, as well as the correlation of the coronavirus, influenza virus, and rhinovirus of the shedding between different samples in systematic individuals with said coronavirus, influenza virus, or the rhinovirus, as well as respiratory virus shedding in respiratory droplets and aerosols that were stratified from by days from symptom onsets. Researchers then went through and explored the data, and based on the data, they came to their conclusion. The study was conducted and generated to explore the effects of surgical face masks on viral infections. Participants were asked to perform exhaling to collect breath samples, nasal swabs, throat swabs, and answer a questionnaire. And in conclusion, researchers found that the effectiveness of face masks is proven to reduce the spread of viruses due to the increase of respiratory viruses shedding in exhaled breath. Thank you so much for your time. I really appreciate it and enjoy your day. Thank you.